Welcome back. South Africa recently experienced a sudden surge in COVID-19 numbers, but there are notable differences between what's happening currently and the first four waves. Due to exposure to the virus and vaccinations, nearly all South Africans have some form of immunity. The current resurgence has only seen a small increase in hospitalizations. This is also a sign the country is entering a new phase of the pandemic. Well, to tell us more about what this means, Michelle Groome from the National Institute for Communicable Diseases joins us. Michelle, thank you very much. So talk to us first of all about this sudden surge in the number of COVID-19 cases. What have we seen this time around that's been different from the previous four waves?
So I mean, we all know that we had this very rapid increase in the number of COVID-19 cases at in December, and that kind of rapidly went up and then came down quite quickly. And then we did see kind of a low-level number of cases in the subsequent months. And I think that was a little bit different to what we saw after the third wave, where cases went down to very low levels after the third wave and just prior to the fourth wave. So we've had this kind of low level of infections that have been spreading. And then about 4 weeks ago, we saw an increase in the number of infections. But this wasn't to the same extent, and the increase wasn't as rapid as what we'd seen with the case numbers that we saw in December, which was, with the beginning of the Omicron wave. And so we've been monitoring this closely. I think there's been a lot of differences this time around. We're 2 years into the pandemic. I think our testing rates are low at the moment. So I think that's another big difference when we compare to the previous waves. As soon as the case numbers started going up, our testing rate was increasing rapidly as well. And we really haven't seen that happening this time around. So our testing numbers are quite low. And I think this just may be indicative of where we are in the pandemic at the moment. Many people have been vaccinated. Many people have had at least one COVID-19 infection. And so when you now get sick with a flu-like illness or with a respiratory tract infection, I think people are less likely to test. And so I think our testing rates are low, and this makes it very difficult to interpret what we're seeing in terms of our usual metrics compared to how we were interpreting these for previous waves. So I think when we look at case numbers, it's a possibility there are far more cases out there, than we're detecting because people just aren't testing. We've also got a lot more reinfections this time around. I think we did see that in the initial phase of Omicron, but also, the more people that are infected previously, will be the more there's a chance for reinfections. And I think the other big difference is that, all the other waves were driven by a new variant of concern. And this time around, we've been seeing these different sub-lineages of Omicron. That initial surge was due to the BA.1. I think that the next kind of surge, which was mainly amongst the school-going age group, was due to BA.2. And now we're seeing the spread and transmission due to BA.4 and 5. So I think there's many differences, and I think at this point we're also we're not many people are getting infected, but it's really the hospitalizations and deaths that we're worried about. We're worried about any pressure that could be put on the hospitals, and those are the types of metrics that we need to monitor in order to have a public health response. We're not going to be locking down or increasing restrictions just based on case numbers anymore. We're really going to only be doing that, in the event that our hospitalizations start going up again. And we haven't seen that happening. There's been what we call decoupling between the cases and the severe disease, which we did see in the fourth wave and is even more pronounced now, where we're having large case numbers, but very few hospitalizations and a very low number of deaths.
Michelle, I think this far into the COVID-19 pandemic, South Africans and generally people across the world have grown tired of having to interpret what for them are sometimes complex, bits of information coming from the medical profession and scientists. So ultimately, given these set of factors that have changed over time and where we are in the COVID-19 pandemic now, what do we want South Africans to do?
So I think really what we're aiming towards is, testing in the more severe people, and I think more a general approach to respiratory tract infections. We're entering winter now. We're likely going to see a lot more influenza cases than we did over the previous 2 years. There was some spread of influenza towards the end of last year, but we haven't had a big influenza season. And going into this, I think, we're going to maybe have co-infections. We'll have circulation probably of COVID together with other viruses like influenza. Already we're seeing the respiratory syncytial virus, which is spreading among children. And so it really is more an approach, a general approach to respiratory tract infections. So those are at high risk, which is generally the elderly, even with influenza, those with underlying diseases. Those are the ones that are more likely to get severe disease and severe respiratory disease, irrespective of whether it's COVID or influenza. And so we really encourage those at high risk to be vaccinated, receive their COVID-19 boosters if they haven't, receive their primary vaccines if they haven't, and also encouraged to get the influenza vaccine as well. And if you develop symptoms, mild symptoms can be treated at home symptomatically, but if you see that your symptoms are worsening, really to present to a healthcare professional, especially if you're in a high-risk group.
Michelle, early on in the pandemic, more than a year and a half ago, it was very, very difficult to see and to predict what long COVID was going to do to those people who had contracted serious infections and perhaps, serious medical consequences as a result of the initial infection. How are we tracking and what are we seeing in terms of long COVID now that we're more than 2 years down the line?
Yeah, so I think it's important. I mean, it wasn't only people getting severe disease that actually can have long COVID. And I think there's some research to show that even mild disease can result in long COVID symptoms. So we are really cognizant of this going forward. I think we have had some studies at the NICD trying to look at long COVID, but I think this is definitely something we need to be putting more effort into and integrating COVID, within our health systems. I think we've been very much treating COVID as a separate disease, and I think we need to be moving that into our kind of other diseases. And so if people are presenting, with long COVID symptoms and, fatigue and symptoms long after the initial infection has resolved, I think that would need to be a holistic approach in terms of trying to exclude other things which might be causing that, and that we are better able to document all these, long-term effects of COVID.
Super. Thank you very much for speaking to us this evening. That was Michelle Groome from the National Institute for Communicable Diseases.